Welcome to my lecture on COVID-19. I'm going to give you about 10 minutes, part of it on the medical shock and part of it on the economic shock, both of which are essential to understanding the crisis that we find ourselves in right now. Now, obviously, I'm not an epidemiologist, but I think it's essential that all analysts, all well-informed people, all government officials understand the basics of how diseases spread, how epidemiologists think about it. So that's the first thing we're going to cover. What I'd like you to look at now is this curve, which shows the epidemiological curve for China. Fortunately, the doctors call it the epi curve for short, so we'll call it the epi curve. Now, an epi curve has on the vertical axis the number of new cases in a day, and along the horizontal axis, it has the dates. And so each of those red dots is the number of new cases on a particular date. Now you'll see that this follows a very clear hump shape, and I want to talk a little bit about the logic of why it follows that shape. Now we're in the first part, the sort of discovery phase. There's very few cases, and since there's very few cases, those infected people are giving it to very few more people. So the disease is spreading, but not very fast, and it's also often quite hard to detect. But once the infected people start infecting enough people, and those infected people infect other people, the disease can enter into its accelerating phase, especially since in the early stage, almost everybody is susceptible to the disease, and every new infectious person is infecting 1, 2, 3 more people. So this thing sort of takes off in what looks like an exponential curve, but it comes to a peak for two basic reasons. One, some of the infected people get better, and two, many of the susceptible people are taking extreme measures to reduce the infection rate, so the infection rate goes down. Now, once we come past this peak, we have the decelerating phase, in which this number of cases goes down for the exact reverse reason that you get fewer people infecting people, and the cases comes down and eventually goes into a resolution. Now, this is the epi curve for China for COVID-19 between the end of last year, 2019, and basically right now. So you see what China has done is it's all the way through the accelerating phase, the peak, and the decelerating phase. And right now they've got it under control. There can be second waves, but let's not talk about that right now. Now, what I want to do now is talk about the fact that this epi curve is not a hypothesis. It's an empirical reality, and it happens every single flu season, and epidemiologists plot it. So here's a slide which shows the epi curves for the seasonal flu in Canada over quite a series of seasons. And you can see all of them follow this classic bell-shaped curve. So that's almost surely what's going to happen in all the countries in Europe and the United States. We're right now in the accelerating phase. It will peak and it will come down. So this is important understanding how to think about this crisis, the shape of the curve. And let me give you a little quote from the Deputy Secretary of Health and Human Services in 2007. It sort of pulls out what happens when people don't understand this path of the disease. What he said, this is Mike Levitt, everything we do before the pandemic will seem alarmist. Everything we do after the pandemic will seem inadequate. Now, I want to dig into that a little more with this particular schematic diagram of the epidemiological curve, the epi curve, and the kind of forecast errors we can make from it. Now here you see the early predictions radically underestimate the path of the disease because people see very few cases coming along. Say Donald Trump saw 14 cases, the next day there was another few cases, and they're thinking no big deal because they're making a linear extraction at this initiation phase which leads them to radically underplay it, underestimate it. But then when they start entering into the acceleration phase, that's the next slide, people start thinking, oh my goodness, this is an exponential growth process, and they start making predictions that radically overestimate the impact of the disease. Now, I think it's important to say that if the media, and as they have, switch between radically underestimating it to radically overestimating, that can trigger panic and poor decisions among the population. So that's something you should really keep in mind. The other aspect that's important to think about with the epi curve is why it's so important to flatten the epidemiological curve. That's what all the containment policies, the radical lockdowns, the quarantines, all those things are intended to flatten the epidemiological curve, and that's what I want to talk about now. If you look at this next slide, you'll see we've got with the red what the epi curve would look like if there are no containment policies. And you see it rises very sharply, it peaks after lots and lots of people have the disease, and then it falls down and into the resolution. The trouble is that this spike can lead to lots of hospitalizations. Now, as you'll know, with this disease, it's highly contagious, but not very lethal. So in fact, there's only something like 10 or 20% of the cases that get it. And that's shown by this little dash curve there. Now, the problem is that spike in hospitalization cases or people who need hospitalization can exceed the number of intensive care units, ICU beds, that are available for treating severe cases. That's exactly what's going on in Italy right now and starting to go on in Spain, and most definitely went on in Wuhan, China. Now, if the need for hospitalization exceeds the capacity, that means that some people who could survive the disease if they got proper hospital treatment will not survive the disease. That will mean people will die who wouldn't have to die if we can just flatten the curve to spread out the incidence. And that's really what these containment policies are about. So the bad news is that the real epidemiologists making forecast in Britain, for instance, Imperial College released a report just a few days ago, simulating that probably even with the containment policies, the ICU bed capacity will be exceeded and there will be unnecessary deaths. So that's not something to look forward to, but it's something to be prepared for. And it is exactly why these containment policies are so important. Okay, let me come to the economics of this. What I'd like you to think about is the recession we are having, and make no mistake about it, we're in a recession already, we just don't have the evidence for it. The recession is a public health measure. The recession is a public health measure. Now here's why it is. The containment policies, the travel bans, the social distancing, what that's doing is keeping workers away from work and consumers away from consumption. Both of those reduce economic activity, which cause a recession. Now there's a couple points that are worth stressing. First of all, it's unavoidable. If we want to save lives, we need the containment policies, and those containment policies are expressly causing a recession. The second is, don't think of the recession as primarily a cause of the disease directly. The recession is primarily caused by the containment policies that are used to fight the disease. In other words, it's man-made. And it also explains why so many governments delay so long in putting in these policies, because they know there'll be a recession as a cost of slowing down or flattening the epidemiological curve. So if you look at the next slide, I'd like you to think about the connection between the epi curve and the recession curve as being tightly related. Now in this graphic, the red curve shows the unconstrained epidemic with no containment policies, and you see it sharply goes up like this. And the recession goes down a bit and then picks back up. when we impose containment policies that push down the epicurve, we make the recession curve, the blue one, worse. So in other words, containment policies flatten the medical curve, but steepen the recession curve. And that's the way it's linked. There's no way of getting around it. However, we can use policies to flatten the recession curve, and in particular, make sure that the recession that comes doesn't lead to long-lasting damage. So what economic policy packages that governments around the world are announcing is a way of trying to flatten the recession curve. In other words, make the curve not as bad as it could be, but also make sure that it's not enduring. So the goal of these COVID economic packages that have been announced in Germany, the US Senate's working on one now, Italy has one, France has one, most of the countries have one now. The basic idea is to go big, act fast, and keep the lights on. In the best case scenario, this medical shock passes in 3 to 6 months. Let's just work with that for a moment. I'm an optimist. And the way I'd like you to think about these policies is in terms of August holidays and September return to work. Now, August holidays are a little bit like the containment policies. Many workers in Europe leave the workplace, and as a consequence, the production and output goes down. So in some sense, there's a recession every August as workers stop working. However, that's not a problem because when they come back in September, all their jobs are there, all their firms are there, all the networks we need, all the infrastructure, all that's running in September. So you just come back and everything goes back to normal. That is the goal of these big economic packages, to keep the lights on, to make sure that firms don't go bankrupt, that jobs don't get destroyed, that the networks and infrastructures that we rely on are maintained and continued. So, in particular, the idea is to avoid long-lasting scarring of the economy. There's other elements of that, not just the support for unemployed workers, sick leave, support for companies so that they don't go bankrupt, support for banks so they don't go bankrupt, cooperation on debt issuance so that governments don't go bankrupt. But also we need international cooperation to ensure that we don't get crazy policies like protectionism or tit-for-tat travel bans that last beyond after the medical crisis is over. Let me close with a message of sobriety. The doctors will develop a vaccine for this virus within the next 12 to 18 months. What that means is the medical shock will pass, and therefore the recession will pass. It's important to think carefully and calmly that the economy will come back. Panic is not the right reaction, but we need forceful government policy to contain the disease, to flatten the epicurve to save lives, but forceful economic policy to make sure that the recession doesn't have to be any worse than it needs to be and doesn't last any longer than the medical shock.